So I'm Allie from Ultimate Health Medical Clinic, and I'm so happy to be here today to present to you guys. To start off, this is my why. So I love to be outside. One of my favorite things is to run. I actually just finished my first marathon, and I know it's horrible, don't ever do it. I'm actually learning how to backcountry ski, and my favorite thing is to hike with my friends and family. And the thing about working at Ultimate Health Medical Clinic is I can actually do those things. I can get outside and be with my family because I take care of my body. So my question for you today is, what is your why? So why do you do the things that you love to do, and what do you do? And then another question is, what if you couldn't do it because you had debilitating pain? So that's where Ultimate Health Medical Clinic comes in. Our mission is we strive to transform lives by delivering life-changing results, helping patients reach ultimate health without drugs or surgery. This is a sign we have in the office that I just love pointing patients to, and we say we believe in helping people achieve a healthy way of life so they can enjoy the good stuff. For me, the good stuff is being outside with my family and friends. For you, I don't know what that is, but if you take care of your body, you can do it. So this is our wonderful team. It's small, but it's mighty. We have 15 of us that work well together to get to the root cause of pain. We have multiple different practitioners with different types of services and skills and discipline, so we all work together to get to that core of the problem. How many of you guys are familiar with the opiate crisis? Most of you guys are, but if you're not, an opioid is a very powerful painkiller that is commonly prescribed to patients with pain. So daily, this is taken from the CDC, 500,000 prescriptions are written out for opioids, 4,000 start non-medical use, 600 start heroin. This is every day. 200 die of opioid overdose, and 90 babies are born addicted. So in the year 2023, we had over 100,000 people die from drug overdose, and nearly 80K of those were deaths from opioids. So clearly there is a problem, and pain is not going away. So our solution here at Ultimate Health is an integrative approach. Biomechanically, we are comprised of 3 different mechanisms. We have joints, our muscular system, and then our nervous system. So this is where a diversified care team comes in. Because oftentimes you'll just go to your primary care, you'll go to a doctor, and they're great, but they only look at 1/3 of the problem. That 1/3 of the problem is only tackling part of your pain. As our diversified care team, we have a whole array of different treatments. So we have chiropractors, we have a rehab team, we have nurse practitioners and our medical team. We have an overseeing medical doctor, massage therapists, different modalities of treatment. So that would be shockwave therapy, decompression therapy, all these different modalities where we can actually look at all 3 of those different biomechanical mechanisms. So these are a few common conditions that we treat. We do neck and back pain, numbness and tingling, headaches and migraines, sciatica, neuropathy, all sorts of joint pain and arthritis, plantar fasciitis, tennis, golfer's elbow, and those are just, the list goes on. So this is the disease timeline. Where do you guys think symptoms show up on this timeline? Beginning, end, middle? They actually are the last thing to show up. So oftentimes when you get a disease or you have any sort of pathology in your body, you don't know for a really long time. And unfortunately, sometimes it's too late. So something that Ultimate Health really prides ourselves in is we don't just mask the symptoms, we get to the root cause of things so that we can actually figure out what's going on, what has been going on for so long. Just some fun facts, just for the sake of time, I just wanted to highlight a few things that our company does. Is we are actually in network with 98% of insurance companies. We've been in practice for over 26 years. Our neuropathy program has a 90% success rate in reversing symptoms. And we have X-ray and ultrasound on site so that whenever patients come in, we can get a full view of their body and see what's really going on underneath. And we are actually now introducing and working on bringing this system into our office for pelvic floor protocol. So just kind of familiarize yourself with any of these key phrases, and this is how you guys can be a great referral partner for me and Dr. Jason. We really like to listen for people who are like, oh, I have a horrible headache. I get up all the time in the middle of the night to pee. I have horrible back pain and I can't go on a hike. Pickleball, my elbow hurts all the time. Just like little things like that, that would just be a reason for you to give them our card. So here are just a couple reviews that we have from the clinic, mainly highlighting our team. Our team is so important when we work together. We have this all-inclusive, this care plan that we give to patients. The team is phenomenal and our patients can see it. something that is near and dear to my heart is my brother. Just watching him have debilitating migraines his whole life, did the traditional route of medications and would do like the Himalayan pink salt in the mornings and all the things he could think of, would go to the doctor, and he would still be out of work for 3 days on end every couple of months, would be locked in a room in the dark, couldn't sleep. And I started working at Ultimate Health, and I was like, you know what, maybe your spine's messed up. Maybe you should come in. And he started a care plan and hasn't had a migraine since. He actually drives 2 hours from Buena Vista, Colorado every week to get his adjustments and trigger points. So he is so grateful, and I'm so grateful. So just to finish off this presentation, the BNI family is so near and dear to my heart. We care so much about each other and the businesses. I just wanted to extend for the next 2 weeks. The clinic decided to do a $49 offer for a consult, exam, and x-rays. So if you or your family or anyone near and dear to your heart is having any of those phrases, oh, I'm hurting, I have some sort of pain, or you're just curious about your spine, we would love to see you and do that initial exam. So thanks guys, appreciate it.